talking about non-invasive surgery with cosmetic doctor, Dr. Maureen Allem, taking your calls on 0891 104207. What do we mean when we talk about non-invasive cosmetic procedures?
Non-invasive means not actually cutting, because as aesthetic cosmetic doctors, we do cosmetic medicine. We don't do cosmetic surgery.
Right.
So as soon as you have to be a plastic surgeon to be able to do surgery. So if you want a breast lift or a facelift or an eye lift, you have to go to a cosmetic or plastic surgeon. They are surgeons. They've trained for 7 years extra to do these procedures, which can be very risky. If you go to these procedures doing, to a general practitioner who specializes in it. But general practitioners may not actually do any cosmetic surgery. It has to be done by a cosmetic surgeon, like a plastic surgeon who's had the extra 7 years of traditional training in a hospital.
You need to cut now, how do people get age spots, and how do you get rid of them?
So it's usually from sun damage, but the problem is the age spots come from the age from you're born, and most of the damage is done before the age of 20. I know my age spots all came from not knowing, being ignorant, spending weekends playing hockey, spending many days in the sun without sunblock, and that. And all those age spots normally start coming out by the age, 40, 35, 40. Every year another age spots come out. And then also the sun also, damages the skin. So it's very important when you're young to put sunblock on, especially living in a country like South Africa.
And it doesn't matter what race you are. I used to get laughed at school because my mother swore blind by sunblock. I mean, we were on SPF 30. Like she would go crazy if we left the house without sunblock, even during the day.
Really?
You're going to school, whatever, when you leave the sun cream.
No,
and my friends used to laugh at me and say, but you're a black person, you don't need sunblock. And it doesn't matter what race you are.
That's the misconception.
The sun is dangerous.
Yeah. As Oprah says, black skin has SPF 500, but you still need to put your sunblock, because black skin and Asian skin, we call them skin type 5 and 6, people of color, their melanocytes are very active. And any kind of insult or trauma or pimple or acne mark or cut or eczema causes pigmentation. And that is a very big problem in the dark people of color. They get uneven skin tone because they think that the melanin is protecting them, but it's not. They won't get the wrinkles, but they're going to get pigmentation. And I'm sure they're all very aware that as soon as every time they get a little acne spot, the acne goes away, but that dark spot remains for a long time.
Yeah. Because
that is the way the skin type is. The melanocytes are very robust and make lots of melanin, which is the pigment in the skin. So it's very important in darker skin to put your sunblock on every day.
Yeah. And I have to put it on every day as well because I freckle. Which is, people don't believe this, but I actually freckle. If you look close enough,
really?
You can see it.
But your skin actually looks quite amazing. It's got a beautiful, even skin tone, and that's what most people aim for, this beautiful skin tone.
Thank you. Thank you very much. Joe in the Northwest. Good afternoon.
Hello, madam. How are you?
I'm well, thank you.
I'm okay. Yeah, I've got a question here. I'm 39 years old, and since I was a teenager, I've been light in complexion and so on. But now of late, my color has started to fade. Like say 5-6 years back. I don't know if that is age spot or something. It's like I'm darker on the sides, but right in the middle, going down to the nose, I still retain the original color. So what can I do?
So is your skin getting darker?
Yeah, it's getting darker. Well, I smoke as well. I don't think so anything, but generally I'm healthy, I don't have no medical condition that I can complain about.
Joe, tell me, have you been using sunblock from a young age? Did you know about sunblock?
Yes, at some stage I did use that, and for whatever reason, I think perhaps financial reasons, I just quit, it's like...
No, you see. So it's that chronic sun exposure that's causing the melanin, because that's what melanin does. As soon as it sees sun, it tries to protect the skin by making more melanin, because the melanin protects the skin. Okay, so it's very important to put the sunblock that you don't get that excessive melanin production. And it's very important to use some kind of skin lightening cream that you can actually stop the processes that make melanin.
All right.
Okay. Yeah, but then one other thing, is there any other sunblock? Most of them are very oily, and my skin naturally is oily, So if I put on sun, it becomes very greasy and so on, and it's very irritating, So I don't know, is there any other kind of sunblock that I can use or would you perhaps suggest that I see a dermatologist to try and reverse the damage or anything like that?
Okay, Joe, you can listen on your radio. Thanks for calling.
Can I reply? Joe, you should try and get a sunblock gel. Something that's not, because ointment is very, very thick, and then you're going to be much oily and greasier. A cream is even less thick, but the best maybe for you to get is a sunblock gel. And maybe a physical sunblocker. But the problem with a physical sunblock blocker, sometimes they make the darker skins very grey because they've got like a white background. So you have to get a good product that's not going to make you grey. And there are products out there, especially for people who get acne as well. They can't afford to put too much cream on their face because then it aggravates the acne. So go get a special sunblock gel. Try find a sunblock gel that will suit your skin type, and try a little bit before to see whether it doesn't make you that grey ashen colour once you put it on.
Could he look at men's moisturising products that have UV filters built into them?
You see, the problem with moisturising products, you don't actually put enough on your skin. You should put at least 1 teaspoon on your skin. So you don't plaster your moisturiser on your skin. So I'd say put the moisturiser with a bit of sunblock, and then get your put a proper sunblock over that. Yeah. That's the problem. We don't put enough sunblock on our faces. We rely on the sunblock and the moisturiser, which is not enough. You need to put a special protective layer over that right at the end.
All right. Someone wants to know by SMS, are skin lightening procedures safe for Asian skins to treat pigmentation and acne scarring?
Asian skin has also got very robust melanocytes. So you have to, before we do any skin lightening treatment, we first pre-treat the skin. And we try to stop as many processes in the skin I mean, some of them are like 8 different enzyme processes that you can stop. Previously was the hydroquinone, but hydroquinone cannot be used indefinitely. You can use it for maybe 3 to 4 months, and then you have to stop, because if you use it indefinitely, you can result down the line with more pigmentation, which is called ochronosis. And years ago, there used to be many patients using very high-strength hydroquinone. And that's when they developed those chubabas. I'm sure you've seen women with these like leathery dark patches on their cheeks. And that's because they abused the hydroquinone. So it's very important, if you do use hydroquinone, you use it for 3-4 months, and then you have to switch to other products that aren't going to cause that problem.
But it's no longer available over the counter.
No, it's not. You have to go to a doctor, right? And you have to be prescribed by a doctor. You can't just get it over the counter.
Yeah, because it becomes
absolutely.
Really, really bad.
So it has to be very, very tightly controlled as to who is getting hydroquinone.
All right, coming up next, we're going to find out what the most valued treatment in any aesthetician's anti-aging toolbox is with Dr. Maureen Allem.
Afternoon Talk with Karabo Kgoleng.
Talking non-invasive cosmetic treatments with Dr. Maureen Allem, who's founder and CEO of the Skin Renewal Clinics. So what goes into your toolbox? What's the most valued treatment in your opinion?
If I had to use one treatment, I'd say fillers. I love fillers. I always say fillers are a woman's best friend.
How do they work?
It's just amazing. The ways that fillers works. Fillers can plump wrinkles out, the wrinkles that you can see. Mm-hmm. But very often women are getting old and they can't quite understand what's happening to their face. They can see that their faces are changing, but they can see wrinkles, they can see age spots, but they can't see the volume loss that has occurred with aging. So by putting the filler in the right place, that's why it's important to go to an experienced injector who can appreciate the volume loss. Mm-hmm. You can put filler into the cheekbones and replace, when you're young you've got these nice little apple cheeks, and as you get older your apples fall down towards your mouth, and that's why you get those deep nasolabial folds. So if you can connect your cheekbone to these nasolabial folds, you put a bit of filler in the middle of the face, you can't believe how it lifts up the face and gives that youthful appearance back to the face.
So it's also administered with an injection?
Yes, so it's filler, but just put in a deeper position in the fat, so it lasts much longer, and it gives amazing shape back to the face.
It's not sore?
Really, it takes a few minutes to do. You put a bit of numbing cream, a bit of ice, and it's bobbles you on. You can hardly. People say, "Oh my goodness, was that all it was?" They always think it's going to be this huge operation and surgery, but it's not.
In my mind, I think people who've had fillers and Botox must have to hide at home for a few hours.
Not at all. Really, they truly walk-in, walk-out procedures. Look, with fillers, you might not that same day, but that night and the following morning, you might develop a little bruise, which quickly resolves over a week. Okay. You know, and you can easily, you know, depending on where you're putting the fillers, you can easily cover that with makeup. But most of our patients go straight back to work. They truly walk in, walk out procedures.
Now, when you've had work done on your face, how do you make sure that it also continues? Because your neckline also shows signs of aging. Do you also treat there, or does that require surgery?
No. Surgery is not going to treat the age spot on your décolleté. Surgery is not going to treat the wrinkles on your chest. You have to have skin rejuvenation treatments, pulse light treatments that take all the pigmentation out. But not only one treatment, because you've got to be very careful. You can't be too aggressive, because then you can burn the patient. So they have to understand all these non-invasive treatments. They walk in, walk out procedures, but the trade-off is that you need more than one procedure to get the best results. And the patients are normally quite happy to walk in, have their treatment, walk out and go back to work. And they're quite happy not to have very aggressive treatments. Because we do have a more aggressive treatment, which is called the pearl laser, which you do the skin, it takes off all the age spots, it helps the wrinkles, but for 4 days you're red. So some of them agree to it, but most of them actually prefer to do the non-invasive, the non-aggressive treatments, and rather come back more times.
Okay, someone else wants to find out how many times one can take Accutane in a lifetime. Accutane is used to treat acne, right?
Yes, yeah. That we know, patients who need Accutane, patients with very severe acne, we refer straight to the dermatologist. They need help. You know, so if you've got more than 5 P5 nodules under your skin, or you've got more than 50 pustules and papules on the skin, then you've got severe acne.
Shame.
And if you don't address that, as soon as possible, you are going to land up with scarring. So we refer all our patients who've got, bad acne to severe acne, because acne is differentiated. You get mild, then you get moderate, and then you get the severe acne. And the severe acne is like an emergency. You have to stop it immediately. And that's where we refer to Accutane. And Accutane, you work according to a total accumulative dose. So once you've passed that dose, then you've got to be careful. That's why it's best to refer to a dermatologist, because they deal with that all the time.
So if I want to, roughly how much does it cost? I mean, to go for a treatment, maybe have a filler in my cheeks and a bit of Botox and the wrinkles around my eyes, on my forehead. What are you looking at on average?
Okay, Karabo. So one area is about 1,200. Another area costs about between 1,800 and 2,000 range to do 2 areas. And if you do 3 areas, which includes your, those vertical lines, those cross lines, the horizontal lines, and the crow's feet, you can anything between 2,100 and 3,600. Once again, depending on how many units you put into the areas. And the more units you have, the longer the Botox is going to last. Very often people say my Botox only lasted 6 weeks. It's because they never had enough Botox.
All right, and then somebody wants to know what to do with hollows under their eyes.
Oh, there's an amazing new treatment that we do. We put a tiny bit of filler, but a special kind of filler. You put in the tear trough, in that area that's dark, because what has happened now, your skin is very thin under the eye. It's not normal skin, and then you lose your padding. So the skin sits right on the orbital bone, and that causes that dark grey area. So it's a quick procedure. It takes 5 to 10 minutes. You put injections in that, but right on the bone. So then once again, it's very important to go to an experienced injector who puts a tiny bit of filler in that area. The filler lifts the skin up and improves that whole hollow dark eye circle. The same applies to people who have started to develop bags under their eyes. So what we do, you put the filler in that area, and then that camouflages the bag. Because the new trend today is not to take too much fat out, because 5 years down the line you may get like a hollow skeletal look where the eye actually goes in, and then you got to put fat back, or you got to put filler back. So that's the way we do. If you've got very bad bags, then obviously you need to go to a plastic surgeon to do an eye lift.
So how do I check that I'm dealing with somebody who is not going to disappoint me or mess my face up?
You just have to ask them, how many treatments have you done? How long have you been doing this? Show me before and after photos that you have done, not from the magazines and the things. I want to see what you've done. And that's what we have. We have a book on all our patients, and to show them before and after pictures of patients who've actually had the treatments. So,
all right. Well, thank you for that. Illuminating stuff. So that's if you want to know more about non-invasive anti-aging procedures, you can find out more from the Skin Renewal clinics. What's the best way to get in touch? Go on the website www.skinrenewal.coza or 0861 skin
SA. 0861 Skin SA.
Lovely. Dr. Maureen Allem, thank you for your time. It was a pleasure having you on Afternoon
Thanks,
Talk.
Karabo. Thank you.